The following is a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions and get an inside look at the latest in healthcare, medical, technology, and treatments. This is Rex on Call. Welcome to Rex on Call live on WRAL. I'm Sharon Delaney for Rex Healthcare. Today we're talking about diverticulitis and other gastrointestinal disorders. It's also National Colon Cancer Awareness Month, and you'll learn about the most recent guidelines for screenings. If you're watching us live and you have questions about GI disorders, you can call in and have your questions answered here live on our program by our experts. The physicians answering your questions today are Dr. Ruth Mokiba with Digestive Healthcare and Dr. Nareej Sachdeva with Wake Endoscopy Center. To call us here at Rex on Call, just dial the number on your screen, 919-744-3876. And if you're watching us as we're streaming live on WRAL.com, email us your questions, rexoncall@rexhealth.com. You can also find us on Twitter and send us a message at Rex Healthcare, #RexOnCall. And while you're calling in with those questions, we want to stress the need for colonoscopies because they can be lifesavers. The screening can also help diagnose one of the most painful colon diseases. The sooner you're aware, the more likely you are to avoid the symptoms.
Better today than I did a few days ago because I've been on very strong antibiotics.
Pat Bulka is suffering from a diverticulitis attack. It's painful and life-altering.
You just feel so wiped out every time you take them.
She says with the help of gastroenterologist Dr. Rig Patel with Digestive Healthcare, it's under control, but it's been a painful road.
My entire abdominal area was very, very tender. It gives you a feeling like, gee, I really need to eliminate, or is there a lot of gas trapped? And then the pain kind of intensifies. It felt like pieces of broken glass going through my intestines.
Diverticulosis, which is usually asymptomatic, and then when those diverticulosis get inflamed, that's called diverticulitis. Think of diverticulosis as weak spots in your colon. So if you increase the pressure in the colon, those weak spots could burst.
With diverticulosis, avoiding constipation is key because a diverticulitis attack can be debilitating.
Diverticulitis can be mild, but it can get really severe. People can get very sick because it can become an uncontrollable infection with abscesses, sometimes requiring emergent surgery.
Dr. Patel diagnosed Pat with diverticulosis a while back and suggested she watch her eating habits, but she didn't give it much thought.
But I was asymptomatic. I didn't really pay any attention to it. And it was years later that I had my first attack.
About 60% of people over the age of 60 will have diverticulosis. But again, most of them are going to be fine. About 5 to 15% of those will get diverticulitis.
Included in that small percentage, Pat. Her first attack last year caused a chain reaction of pain and illness.
But I not only had that, but I also had a hernia, I had gastritis, and I also had Barrett's esophagus, which is due to reflux.
She says diverticulitis is life-changing in that she can't eat pizza anymore or any high-carb foods without suffering the consequences.
And what worked best for me was eating a high-fat, very low carbohydrate, about 20 carbs a day, and moderate protein. That really kind of healed my entire digestive tract.
Eating a healthy, high-fiber diet can help ward off an attack. Dr. Patel's first prescription.
Making sure that when you're over the age of 50, you've had your colon cancer screening, and that is a very important part of colon health.
He also urges patients to drink plenty of water, have regular bowel movements to prevent colon pressure, and to exercise. Doctor's orders Pat now practices every day. It's advice we could all take. And as we shared with you earlier, March is Colon Cancer Awareness Month. Screening is the #1 way you can reduce your risk of colon cancer. And despite its high incidence, colon cancer is one of the most preventable and, if found early, most treatable forms of cancer. Here are the most recent guidelines for screenings. You should get your first colonoscopy by age 50 unless you have symptoms or a family history of colorectal cancer or polyps. In those instances, you should see your doctor earlier to discuss screenings. However, African Americans should get their first colonoscopy at age 45. Joining us now are Dr. Ruth Mokiba and Dr. Niraj Sachdeva. Let's start with the screening questions. And what would be a symptom or certain set of symptoms that would send us to go possibly get some screenings if you're not 50 yet?
So concerning symptoms are a change in the bowel habits, a change in the stool caliber. So the stools may go from being nicely formed stools to very thin stools. That's very concerning. If you're seeing blood in the stools, that's also a concerning symptom. An abnormal loss of weight or abdominal pain that is not really explained by other reasons.
So you can't just blame aging?
Absolutely not.
Okay. All right. A question.
Another important factor is to send the message it's important to get screening before we develop symptoms.
Yeah, so don't wait until the symptom comes.
Absolutely.
All right, so age 45 if you're African American, age 50 for everyone else unless you have a family history or symptoms. All right, we have a question here from one of our callers. Miss Lynn called in asking, do you really need to avoid nuts and seeds if you have diverticulosis? I hear that a lot.
So that's actually a very good question. It's a myth that avoiding nuts, seeds, peanuts, popcorn can cause diverticulitis.
So that doesn't get trapped in those little pockets that we see?
We think it's an old wives' tale, and people will read this all over the internet. But and some patients swear by it. So those patients, we tell them to avoid those foods. But generally, for the general public, I think the short answer is it's a myth.
Okay. All right, can diverticulitis cause other abdominal pains?
Right, so diverticulitis typically presents with abdominal pain. You normally would get pain, lower abdomen, depending on where the location of the problem is. There are some patients with diverticulosis, which is just the pockets without any inflammation around the pockets, who do get some sort of mild chronic pain in that area. It's a little bit different from when you do get the diverticulitis. So yes, to both.
Okay. We have another caller who says she cannot go out in public because immediately after eating, she gets diarrhea. So would you have any suggestions that she should be seen, right?
Absolutely. Please call our office.
Yes, Dr.
So very important point here is that diet is an important part of this. So we explain to patients, keep a diary. Start with lactose-free diet. Try that for a couple weeks to maybe even a gluten-free diet. And also use of probiotics. These things can help. But like Dr. Ruth said, very important to see your physician.
All right, another question here, which is, I think, a pretty common one. So this person had a colonoscopy in 2008. So when do you get the next one?
Right. So typically the recommendations for screening, you set at age 50, unless obviously you have it sooner, and then it's every 10 years if it's a normal colonoscopy. If there are polyps found, depending on what type of polyps and the number of polyps, the doctor might decrease that interval. So anything from 3 to 5 years, or sometimes even sooner. Now, if there's a family history of colorectal cancer or colon polyps, then that interval definitely is a lot less than either 10 or 5 years. So it just depends on what was found on her colonoscopy and her family history as well. Okay. So she needs to discuss, her physician with the physician.
Go talk to her doctor
Absolutely.
about it. Or what would you recommend for prevention of diverticular disease?
Sure. Well, simple answer there is a well-balanced diet, plenty of fruits, plenty of vegetables, a high-fiber diet, and avoiding processed meats. So diet is a huge part of this.
I guess I'm thinking, as you get older, you just expect gut problems, but it doesn't have to be that way, does it?
No, it doesn't. So typically with diverticular disease, as we all get older, the risk of getting diverticulosis is increased the older you do get. However, having diverticulosis doesn't necessarily mean that you have to have symptoms with it. So I think that the old adage that having gut problems as you get older really should not be the case.
Okay,
yes.
good. So really you say diet is important. So lots of
Absolutely.
fruits and vegetables.
Absolutely, high fiber diet,
Okay.
lots of water as well, you know.
All right, do you find that typically Americans just don't have a great diet? Average people?
Sure. I mean, this is something we stress in our clinics day in and day out, the importance of a high fiber diet, avoidance, and the importance of blueberries, blackberries, pomegranate. These are foods that have these are foods that have antioxidant potential and can decrease the development of polyps and diverticular problems.
Okay,
If I may add,
Yes.
the recommendations for fiber, typically 24 grams of fiber daily in women and 30 grams or more in men daily. It's very, very hard to make that.
To achieve that. But work toward it for sure.
Absolutely.
Okay, well, we are back right after the break to answer your questions. Just give us a call or send us an email. Welcome back. This is Rex on Call Live at WRAL, and today we are answering your questions on gastrointestinal disorder live right here, and we're also talking about diverticulitis and colorectal cancer. And if you have questions for our experts, just call 919-744-3876. And if you're watching us as we stream live on WRAL.com, you can get your questions answered there as well. Just email us at rexhealth.com or tweet us at RexHealthcare, hashtag RexOnCall. So let's take some more of these questions. One person has just called in asking, is diverticulosis life-threatening?
So the answer to that is no. Diverticulosis by itself is typically asymptomatic, so you don't have any symptoms with it. However, if you do have complications from diverticulosis, and about 10 to 25% of patients with diverticulosis will have a complication, and diverticulitis is one of the complications, and that diverticulitis could present as either some inflammation, or you can have a rupture of the diverticulum.
And that's emergent surgery, right?
And that's where
Okay.
it could be a life-threatening problem. So it's the complications of diverticulosis that could potentially be life-threatening, and even that in itself, that risk is small.
Very low, okay. A caller here says that they have heard of a colon rupture during a colonoscopy. What are the chances of puncturing the colon, and if it were to happen, what happens next?
All right, I think the point there is a chance for a perforation, which is a rupture of the colon, is very rare. The book answer is 3 in 1,000, but in actuality, in a screening, it's much lower than that. The rate is as low as 1 in 5,000 cases.
Now, I've heard of a failed colonoscopy, and then there moves on to another diagnostic test after that, isn't there?
Sure. Some patients can have a tortuous colon in which we can do additional testing such as CT colonography or a barium study. I think for the most part, the take-home message is these procedures are very safe, they save lives, and they should be done in the right population of patients after consulting with your physician.
Okay. All right. We have a 50-year-old who's called in and had her first colonoscopy 8 years ago, did not find any polyps, but there are some other issues that are presenting, anal fissures and very bloated feelings. These new symptoms have arose. So should she seek another colonoscopy or go see her doctor about this?
I'd recommend that she definitely go see her doctor. The combination of the anal fissures and difficulty with bowel movements might suggest some ongoing issues with constipation, and she does not necessarily need a colonoscopy at this point. However, one needs to get the full picture to make a better recommendation, so she would need to see her doctor about that.
Okay. Another person here, constipation has been really bothering her over the last month. She has Graves' disease. Are these complicating matters that she should see a gastroenterologist about?
Absolutely. Certainly we know that thyroid disease can affect the colon. In terms of hyperthyroid, can cause diarrhea. Hypothyroid, it can cause constipation. And these symptoms certainly should not be ignored, and you should see your physician.
Okay. Well, coming up, we will answer more of your questions. Just call 919-744-3876 or email us your questions at rexoncall@rexhealth.com. We'll be right back. Welcome back to Rex on Call here live on WRAL. To reach us, call 919-744-3876 or email us your questions to rexoncall@rexhealth.com. And we are taking your questions about gastrointestinal disorders, diverticulitis, and colorectal cancers. But first, as we've been discussing, colorectal cancer is the leading cause of cancer deaths in the United States. But many times it can also be prevented. However, prevention begins with routine screenings. I spoke with a Rex patient who says a colonoscopy saved her life.
I took it as strive. I'm gonna beat this thing. I'm not gonna let it get me down. I'm not gonna get depressed.
Willistine Knight made those promises to herself when she was diagnosed with stage 3 colorectal cancer last year.
I'm feeling pretty good. The first couple of days after chemo, you're very tired.
Tired, but thankful that the cancer was caught in time during a colonoscopy last March.
And then in September, I had surgery for them to take it out.
Successfully removing the cancer, Rex Hospital's colorectal surgeon, Dr. Matthew Strauch. He's part of Rex Hospital's Cancer Center, which takes a holistic approach to patient care.
Radiologists, the pathologists, geneticists, nutritionists, to have a full comprehensive discussion about the patients, about their plan of care.
A plan of action designed for each patient. Colon cancer is curable, but often it takes early detection.
So colonoscopy is not only a diagnostic test, but also can be therapeutics.
The goal is to detect any precancerous lesions called polyps during a colonoscopy.
If you see a polyp and it's removed at the time of the colonoscopy, that could prevent that lesion from becoming a cancer later on.
The later the diagnosis, the more likely a patient will need surgery and chemotherapy.
But it is clear that the earlier you find it, the earlier you treat it, the better the outcomes.
The outcome is bright for Mrs. Knight, who made sure to get a colonoscopy every 2 years.
Take your colonostomies. Get them every 2 years or whatever your doctor prescribed for you to do it. It's a lifesaver.
She credits her faith, family, and the Rex support system for getting her through.
So I've had a lot of support through this, and I thank God for all of them.
Part of that support, Rex nurse Erica Shoemaker, who serves as a patient navigator.
Ideally, we meet them right when they first receive that suspicious diagnosis of an abnormal mass.
The navigator will help serve as the glue to our team.
Shoemaker shepherds patients through what undeniably is a scary and sometimes confusing time.
They can call me back with any questions about their biopsy results, or what is a CAT scan like, or what does a PET scan mean. It's helpful to have a connection.
She's very thorough with me. She talks to me about things that I don't understand. If I didn't understand it, she'll explain it to me again.
She also helps with transportation and financial resources, and just gets to know the patients and their families.
What are you going to do when it's all said and done?
I'm going fishing.
Good for you.
I'm going.
Good for her. Miss Knight is almost done with her treatment, so we do hope you get to go fishing very soon. Now, coming up on Saturday, March 21st, Rex is hosting a free community event, Living with and Beyond Gastrointestinal Cancer. It's at the Marriott Crabtree Valley in Raleigh from 8:30 a.m. to 12:30. There will be a panel of physicians, a nutritionist, and other experts. Call 919-784-2345 to register, and we'll also have links at rexhealth.org. We are now going to have our final round of questions. Right now, let's talk about treating diverticulitis, or should we start with losis? So let's say because you get losis before you get litis, right?
Right.
Or am I simplifying it too much?
You need to have the osis first.
Yeah, okay, so what are the treatment methods? Is it just a change in diet?
So to prevent diverticulosis, we normally recommend a diet that is high in fiber, making sure that the bowels are moving properly. As in the segment earlier, Dr. Patel mentioned that one of the things that we think causes diverticulosis is just increased pressure in the colon that weakens the wall of the colon. So you get these little pockets or outpouchings that form. And so if you have a good bowel regimen, a diet that's high in fiber, that risk is slightly low of getting diverticulosis.
Okay. All right.
But to answer your question further, treatment would be, initial treatment would be antibiotics.
For diverticulitis.
Okay, for the itis, right.
Diverticulitis.
And hopefully you can get it under control before having to move to surgery.
And in rare cases, especially with recurrent attacks, those are the patients that go on to surgery.
Okay, we have one caller who asks, what are some easy ways to add fiber to the diet? Because as you said, it's a good amount of fiber we should be having both as men and women. What would be your suggestion?
So fruits and vegetables, apples, the berries, most of the berries, blackberries, blueberries are very high in fiber. There are a lot of high fiber cereals out there that are very, very helpful. And then vegetables, kale, spinach, beans, navy beans, black beans are very, very high in fiber.
Do you ease into that? Because I would
Yes,
imagine that it
absolutely.
might cause an awful amount of bloating or gas if you jump right in on that, right?
Absolutely.
Could you talk with a nutritionist maybe?
Sure, sure. Dietary recommendations certainly are valid.
Okay. Well, we do have one final round of questions coming up after the break. This is Rex on Call. Welcome back to the show. This is Rex on Call. We're taking your final round of questions right now. And as always, we do want you to consult with your doctor beyond the show today. So let's get started with some statistics that is rather alarming, that are younger patients, younger than 50, actually seeing more colon cancer diagnoses.
Absolutely. That's an excellent question. Well, we know that from years of doing screening colonoscopies, the message is getting across. The more and more people are getting colonoscopies, we have seen the rate of colon cancer decrease at a rate of 3% a year every year for the last 10 years.
That's terrific
That's
news.
over the age of 50.
Okay.
However, over the last decade or two, we have seen the rate of colon cancer increase by 1.5% a year every year in patients younger than age 50.
Wow. Now, what do you attribute this growth in that age group to?
Diet, sedentary lifestyle, smoking, obesity, these are the common factors.
Wow.
And this is, once again, we stress patients younger than age 50. If you're having symptoms, you really need to see your physician.
Okay. So are there specific ethnic groups that are more likely to get colon cancer? Dr. Mokiba?
Yes, so studies have shown that African Americans, when they develop colon cancer, even if they are matched with their peer, non-African Americans, the African Americans get more aggressive disease. Okay. So the recommendation that came out a few years ago was that African Americans start screening at age 45, and that's a very important point to get out there. We're seeing a lot of patients coming in, and I think it's important to get screened at 45 if you're African American.
Can you go to your primary care physician, or do you need to go to see a GI doctor in order to get that screening?
So you do not need to necessarily go to your primary care physician. I would start with, you can just call your GI doctor's office. Your primary care physician can help facilitate that move to say, well, go over here and get screened. Definitely speak with the insurance company to make sure that it is going to be covered and it should be covered.
Okay, well, thank you so much. And as we said earlier, please do consult with your physician on any health concerns. And we want to thank today's experts and to our phone bank for taking these calls. And if you're looking for a doctor beyond today's show or need a direct referral, you can call Rex HealthNet, Rex's free telephone information service. The number is on your screen. It's 919-784-4490. And join us next month for Rex on Call, when our topic will be bariatric basics, weight loss surgery, and better health. That is April 20th, right, or here at 1 o'clock on WRAL. And you can email your questions ahead of time to rexoncall@rexhealth.com. And before we leave you, we invite you to be on the lookout for hundreds of beautiful irises that will grace Rex Hospital's campus in April. They will help raise awareness for mental illness, and volunteers from the National Alliance on Mental Illness are placing them there. Again, thank you so much for your time today. We'll see you next time.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.